So can you explain like how it's done and what the equipment is in terms of a child can understand?
Sure. So the catheter is part of the name of the procedure is called catheter ablation. So catheters are little tubes that we put from the leg vein that go, and then they travel up the vein and go up into the heart. And those catheters are basically wires. They're covered with plastic. So they're flexible, and I say they're like partially cooked spaghetti. They're about the size of spaghetti, and they bend like spaghetti would. Not like totally cooked spaghetti, because that would be too floppy. But they're very good about traveling up the vein and just conforming to the shape of anything that we put them in. And some of them are really cool in that they have a controller on the outside that I can pull the controller and it can make the catheter bend, so I can get it to go exactly where I want it to go. And I can rotate it and bend it, and so I can get anywhere I need to go with it. And so that's the catheter part. Ablation means to get rid of it. Okay, so the ablation part of the thing is the burning, or I call it the zapping part. And we can either heat up the tip of the catheter, or we can cool down the tip of the catheter. There's two different ways of zapping the fast heartbeat. So what we do is we go in, we do a lot of fancy mapping where we look for how the electricity is traveling around the heart, and we find the earliest spot that the electricity is getting back up to the top chamber. And then once we've found that, and we do that kind of like that hotter, hotter, colder, colder game that you play as a kid, where are you close to it, or are you farther away, until we get exactly into the right spot. And then once we've gotten to exactly the right spot, we can heat up the tip of the catheter, or we can freeze it and get it really cold. And both of those techniques will burn out the bad area of the heart tissue.
Is it possible for there to be more than one bad area of the tissue?
Yes, that's a good question. In about 10% of people, there's two pathways. And if we find one and get rid of that, and we start looking around more at the end of the first procedure, and we'll just keep going and get rid of the second one if it's there too. So we get everything done in one day, hopefully.
Right. So like, what are common questions your patients have? I mean, I'm guessing one of them is like, does it hurt a lot?
Yes, that's a good one. Yeah. The only thing that hurts is for older kids, when we have you go to sleep during the procedure, you do have to have an IV, which is a little needle put into the vein in your hand. That's really the only thing that hurts the day of the procedure, is getting that little IV put in. For younger kids, we can put them to sleep with a mask, so they don't even have to get the IV before they get to sleep, so they have nothing that hurts, which is good. But then after the procedure, the leg where we put the tubes in, your leg can be somewhat sore, like a bruise. So if you've played soccer, or you've ever gotten kicked by your brother, the pain's not much worse than that, so it's not bad.
So is there like a certain age or height or weight where you start separating just mask and then IV?
Mm-hmm. Usually at about 13, we start to go with just the IV, and we don't. The mask means you've got to be put fully asleep, and you've got to have a breathing tube in. So older kids are easier to give just the IV medicine to. Younger kids are too wild; they'll jump around too much. So we have to put them completely to sleep. So, but about 13 is a good cutoff. Depends somewhat on the maturity of the kids. So some 12-year-olds, I'm like cool with just doing the sedation, and some 13-year-olds need full anesthesia.
Right. So how soon would a patient be able to like get up and do sports or varied activities?
So usually within 2 days they can go back to school. I have people stay home at least one day after the procedure and rest. The next day they can go back to school but not do any sports or physical activity. And then at about 4 days after the procedure, they're free to go back to everything normal. But the main activity I like for people to stay away from is anything with a lot of running or stretching of the leg, because that's the thing that's going to hurt your leg. But it doesn't hurt your heart at all, and so carrying a backpack is fine.
Okay. I think that's good.
Can you tell me what happened? What brought you to see me? I can't remember.
So when I was 10, I kept feeling like my heart was beating really fast, and I mean, it happened like a few times in one day, and at first I didn't really know what it was. It was uncomfortable, but I mean, I didn't have any reason. I was at school, I didn't have any reason to say, can I go to the nurse? Because I didn't know it was a problem. And then as it continued throughout the day, it just kept getting more and more uncomfortable. So I told my mom when I got home, and she called the pediatrician. They said go to the hospital, and from there they stopped the fast heartbeat and said to come see you.
So you were still in the fast heartbeat rate when you got to the emergency room that first time?
Yeah.
Was that the first time it had ever happened to you?
Yes.
Is that really scary?
Yeah. I mean, I didn't know it was happening.
Did you feel dizzy or feel like you were going to throw up or anything else when it happened?
I mean, I know like a lot of times, more recently, I get really bad headaches when it went on for too long. And yeah, I guess dizzy would, I felt like my hands and feet were tingling.
And what made you and your parents decide to go ahead and do the ablation rather than just stay on the medications?
I know like a year before I actually said yes to the ablation, we looked into it and met with Dr. Clausen, the electrophysiologist, because my mom really wanted me to get it done because she was worrying about it a lot, but I was just afraid because, I mean, it was like a procedure done on my heart, so, but then it started interfering more and more, and it was like no matter how precisely I'd take my medicine exactly the same time every day to try to regulate it, it kept coming through, and it just got to the point where it was interfering too much and was restricting my activities. I wasn't able to play softball, or so I decided to get it done.
What do you remember from that day? Was it a pretty scary day too?
Yeah.
Was Dr. Crossan nice to you?
Yeah.
Okay, just checking.
I was scared, but I really didn't have any reason to be, now that I remember it. I just went in, but I had to wait a while, because I believe the patient before me just ran.
Over?
Yeah. I'd say
that was pretty hard waiting, I bet? You just get more and more nervous as you were sitting there waiting?
Yeah, that was hard. I mean, I'd say the only part that was bad that day was just getting the IV, and that's because I'm afraid of needles, so it was it wasn't even that bad.
Do you remember anything about the procedure at all? Or did you just live through the whole thing?
Wow, I remember going into the room. Somehow, I can't exactly remember the transition, but getting onto the operating table thing. And, let's see, I remember they put lots of stickers and, what are they called? The EKG stickers all over my chest. Yeah, and I was afraid to go to sleep because I was just afraid, so I kept trying to ask questions to stay awake. Well, what's that?
Did that work?
No. Someone put something on my face like a mask. I don't know what it was, but then I fell asleep.
Great. And what was it? What did you feel like when you woke up? You were in the recovery room, I guess, right?
Great. I was really thirsty and really hungry because I hadn't been eating. But it felt fine. I was really tired and kind of a little bit out of it, but it didn't. I wasn't in significant pain.
And have you had any more of these abnormal heart rates, or has the procedure taken care of everything?
It's taking care of everything. It's good now.
So you don't have to take any medication, and you haven't had any more episodes. That's great.
Good.
Yeah. And how about the medications that you took? How did they make you feel? Did you feel any different on them, or?
I guess I was more tired, and I was kind of slower in sports. I mean, it was kind of hard for me to tell after a while because I couldn't remember when I wasn't taking it, what the difference was. But I mean, I was tired sometimes, but that's it, really.
So I guess it's safe to say that you're happy you had it done?
Yes, I am very happy.
and Dr. Carlson did a good job. Good. So Jane, I have this 10-year-old patient who has come to me complaining of rapid heart rates on occasion, just out of the blue, not with exercise. So I was wondering what you thought would be the best way for me to sort out whether or not this is just a normal thing or if we had to worry about these palpitations.
Well, the first thing I would recommend is that we try to get a recording of the heart rate when the child is having the arrhythmia, or thinks they're having the arrhythmia, because that would be really useful in determining what type of fast heartbeat it is and whether it's a truly abnormal rhythm or just a normal, increase in the rate when they're nervous or whatever.
So when you say an arrhythmia, what do you mean by an arrhythmia?
So an arrhythmia is just means the rhythm of the heart is either too fast or too slow. But mostly what people are complaining about, the type that this young lady is talking about, it's usually a fast heartbeat.
And what are the possibilities? What kinds of fast heart rates could give you these kinds of symptoms?
Most kids who have this kind of symptom will have an extra electrical connection in their heart that causes their heart to kind of short circuit. So the electricity goes around and around in a circle rather than going down to the bottom and starting over the top again. So it can create a pretty fast heart rate.
So my patient's mom is really worried. How dangerous is this?
For most kids with this kind of problem, it's not dangerous at all. It's just very irritating, and it interferes with their life and causes them to feel uncomfortable when it happens.
So if we were to find an abnormal fast heart rate or tachycardia, what would be the options? What should we do about that if we need to do anything about it?
For some kids, the events are so short and so infrequent that once we've identified it and everybody can kind of calm down and realize it's not a life-threatening problem, they can just say, oh well, I'm not going to worry about it. And they can often even stop it by holding their breath or blowing into a balloon or putting ice on their face or something like that, and then there's really nothing you have to do about it. In kids where it's more concerning, it happens more frequently, the episodes are lasting longer, or they don't stop easily, then there's two options. One is to take medication for it, and some people, that's an easy option for them. Some people hate taking medicines. So for the ones who hate taking medicines, or where the medicine's not working well, or there's side effects from the medicines, then the other option is to do what's called a catheter ablation of the fast heartbeat. And for that, what we do is we have to go into the heart from the blood vessels in the leg. We go up into the heart and we find the spot in the heart that's causing the problem, and we can actually burn out that little tiny bit of tissue and get rid of the fast heartbeat. So that's a permanent cure, which has its advantages.
So if you're burning the heart, do you worry about causing any damage in there?
Well, this area that we're burning should be scar tissue already, and it's not. It's the area between the top chambers and the bottom chambers, and right where they join together, there's a rim of scar tissue. And in the case of an extra pathway, the scar tissue is actually interrupted by a little piece of muscle that shouldn't be there. So all we're doing is really turning that muscle back into the scar tissue that it was supposed to be. Because scar tissue can't conduct electricity, but the muscle can, and that's the problem, is that you've got an extra way for electricity to travel through the heart that shouldn't be there anyway. So yes, you're causing a little damage, but you're causing it in an area that it's not important to the heart, and it really shouldn't be any muscle there in the first place.
So before I let you do this to my patient, is there any possibility that this will just go away on its own?
That's a very good question. Some children it does go away, and that's a reason that some people like to wait longer to give themselves a chance for it to go away. But it's if you're having it at age 10, the likelihood of it going away is less than 10% over the next 10 years. So, it's not likely for it to go away. Some people think it's worth waiting to find out.